and I was muted when I started this. My goodness. Good afternoon, everyone, and welcome to another edition of the Christian Recorder Dialogues. We are indeed excited to have with us a very distinguished panel as we celebrate one of the, if not one, the most important connectional auxiliaries, especially during this time, the Connectional Health Commission. And before we begin, as always, we encourage you to put your chat, your district in the post. Post your districts in the chat and whatever thing else you want to share. And please like this. And so we'll go around and introduce everyone. We have Bishop Francine A. Brookins, the chair of the Connectional Health Commission. We also have with us, Episcopal Supervisor Dr. Miriam Burnett, who is the medical director. We have with us Dr. Natalie Mitchem, who is the executive director. Exhorter Gwen Williams, who is the immediate past medical director. Executive Director, and Presiding Elder Rosetta Swinton of the 20th District, who previously served as the Medical Director of the 7th Episcopal District. Thank you, everyone, for being with us here today. We are excited to give honor where honor is due and to share the good work of the Connectional Health Commission. Welcome to the Christian Recorder.
Thank you very much.
Thank you very much, Fuller.
All right, well, we're going to go ahead and get into our discussion. So, Dr. Burnett, this question is for everyone, and because all of you at some way have had a role in the work of the Connectional Health Commission. So I want to start by asking, we're celebrating 30 years of the Connectional Health Commission. How has the role of the Connectional Health Commission shifted over the last 30 years? I mean, I remember as a kid going to meetings and thinking of, oh, those are the people in the back of the tent who take your blood pressure. But it's been so much and really always been more than that. So just talk to us about how the role has changed. And we'll start with you, Dr. Burnett, and work our way around.
It really has evolved in terms of the public health emphasis. We started with, actually, when you talk about Dr. Berry, our founder, you talk about mission work. His initial white paper was on missions and medicine and how that role was important to the AME Church. That was in 1936. By 1946, he began doing work around taking the National Medical Association, which is the Association of Black Physicians, coupling them and their research and students from the National Medical Association, the NMA, now called the SNMA, Student National Medical Association, and pairing them with churches. It wasn't until I discovered his papers, actually through some of the work you were doing, that I realized that we had come full circle. There was a time where we were doing nothing but first aid stations, and Gwen can tell you more about that because that's actually how she launched in. And so I'm going to defer to her to talk about that. But somewhere in the 1990s to 2000s, we really began to embrace the public health mission field, and it's just progressed from there. Gwen?
Good afternoon. In 1980, I was asked by Bishop Cummings if I would chair the first aid team for the general conference that was meeting in New Orleans. And he asked me to reach out to Dr. Berry to see what needed to be done. And so I contacted Dr. Berry, who said to me that he used the Red Cross. And since I was in New Orleans, that it would be up to me to plan whatever needed to be done, since I was familiar with the city and the local Red Cross. I was a Red Cross nurse volunteer at that time, so I didn't know how the Red Cross operated. My local church union, Bethel, had a health commission of which I was the chairperson of. And so I pulled on them and some of the staff from 3 of the other churches in the city. And we met and we developed a plan of what to do, because what we discovered was that there was no equipment, no money, nothing to put this in place. And that we knew that if the Red Cross came in, that they would be in total charge and we would have no say-so whatsoever except to be there as volunteers following their direction. And so we opted to go out on our own since most of us knew what we were doing and just expand it on a larger scale. And so we set up in the Hyatt Regency. We were able to secure a room in the Hyatt Regency to put the first aid station. And we equipped it. We used our stationery for the triage and any other stuff that needed to be covered. And so we were ready to go. And so that's how we got started.
It's interesting to me as you're talking about this fact that we're still talking about self-reliance, how you said we needed to have our own control of our own health situations, because if we didn't, we wouldn't have created that knowledge. And that to me is a great testament to the work that you did. And you brought up the name of L.L. Berry. And as a Chicago resident still, we were talking at the beginning about how L.L. Berry was known for being a Chicago resident. And his father was a general officer. He was the director of missions. And L.L. Berry was known throughout the Chicago community. And his papers are actually at the Carter G. Woodson Library here in Chicago. Elder Swinton, Reverend Mitchem, would either of you like to comment?
I'm muted.
Yes, ma'am. Go ahead.
Okay, I'm unmuted. Okay, I would add, as Reverend Dr. Burnett said, the shift to public health, certainly being known for the first aid that we administered, and all respect and honor to Gwen and all that she did to establish that. So the shift of the 20 years was also, like she said, to combine the fact that, yes, we're there to give you those Band-Aids, to check your blood pressure and your blood sugar, but also to let you know that we're here to talk to you about preventive health. And that allowed us to share that message with the nurses units, the nursing guilds, the different titles that they have, so that, again, we could begin to expand so that we could continue to touch the lives of the congregants, and not only the congregants, but the community.
When you look at the 20 years, you look at a shift from when we would leave General Conference, we would leave many people in ICUs and hospital beds, some not to leave. And now we're at a place where the last two General Conferences, we lost no one. We left, we had people go to the hospital, but then they rejoined us during the meeting. People are now starting to take care of themselves in a better way. And I think, and I would like to believe that the Health Commission served a large part of that with all of the resources that we've provided on the website, the Facebook page. And every time we turn around, we're trying to find new ways to convey important preventive as well as methodology to treat. One of the things that we know from a self-reliance standpoint is we get lesser care because we don't ask the right questions. And I think that's one of the most important things that we've done over the last 20 years is ensure that that people know the right questions, that they know how to get a healthcare advocate, and to be able to address their personal needs, wants, and desires in a real-time way.
And we've continued to improve our website so that our website could be that one-stop shop for getting health information that you need. And what's interesting is that not only does the AME Church utilize our website, but other denominations utilize our website as a place to go to get relevant information, on-time information. With COVID-19, we were offering webinars and staying abreast of what was going on, and on the website having a tracker so that you could see where the incidence of COVID-19 was moving. And again, we continue to update it because we want it to be relevant, and we want the community and the churches at large to continue to go there again to get that information.
I would like to add also to that, the focus shifted to public health, prevention, but key in that was empowering people to also be their own self-advocate as their knowledge of their health situation was improved, especially through the health education programs that were done. And also, there became an expansion in partnerships and also access to other services that we otherwise didn't have, primarily because of lack of funds to do those things. So those agencies, hospitals, and other organization, NGOs that were receiving grants from various avenues, CDC and others, through partnerships, we were also able to expand to another level and even promote that each Episcopal district should have a health director, and then the annual conference level, the presiding elder district level, and then at the local level where the impact could spread, not only just to that local congregation, but also to the communities that these churches served. So that was also one of the things we evolved into.
And if I could just overlay the word relationship here, I think it's significant when you look at the transition and the evolution of the Health Commission from the first aid station, where people knew each other by name in the first aid station. You knew whose blood pressure was up and who came in the AME family. And we trusted those persons in that first aid station. And now I think there are many of us throughout the connection who consider Dr. Burnett to be our personal physician, Dr. Collins to be our personal physician, Dr. Mitchem to be our personal nutritionist. In a way, for us, I know I pay an extraordinary amount of money per month for healthcare, but I never feel like I'm getting any personal care. And so there's a way in which these individual relationships have empowered almost every member of the African Methodist Episcopal Church to feel like we have our own special doctors who we can consult. And when we go into these machine hospitals, we feel like we have somebody we can call. And it has been from the least of us to the greatest of us at any point that we feel like we have personal help. And I think that has not been lost in this great transformation from first aid stations to now over 14 thriving ministries impacting the world.
You know, I think because the Health Commission has done its work so well, we take you all for granted. That's one of the reasons today why we are highlighting the work and celebrating this tremendous ministry, because there is no ministry like this in any other historically Black denomination. They look to us for leadership in health issues. And if I could just take a moment to share my favorite Health Commission story is when all the bishops got tested for AIDS at a general board. Now, that to me was a stigma breaking moment. And to see the bishops of the church all go out, get HIV tested, come back, to me spoke volumes of what we were trying to show and do. And, you know, I just thank God for the Health Commission. Being the son of a doctor, the son of a nurse, I thank God for what you've done and the unsung ways that you've helped us. And that brings me to my next question. You know, we celebrate your ministry, we celebrate what you do, but what are some of the challenges that have impacted the work of the Connectional Health Commission over these last 30 years, especially the last 3 years? Anyone want to start with that one?
When we think of challenges, I think they can be in more than one way. Some positives, some negatives. I'll just mention that one of the challenges having enough health champions. There's still need for more active health champions. It's vitally important to the success of the health ministry that there's full support of the church leadership on all levels. I mean, the leadership should include all of the bishops, all of the presiding elders, the local pastors who are very key, especially at the local level, and also even our presidents of our components. We need champions like the WMS, YPD, Lay, Sons of Alan, Rayak, Daughters of Sarah, all of the components, because these individuals become champions in their various components to help us with the work of prevention and improving the quality of life for people. So we need more champions. And the focus should not be limited to just the spiritual health, but also we need to look at whole person health. That part of it is very important. We know that, yes, we're spirit, we live in a body, we have a soul, but we need to look at the whole person in our ministry work. So we should look at the physical. We need to look at the educational, the social, the mental wellness part, as well as the financial health of people, the environment. Of course, we don't want to leave out the spiritual, but we want to improve on whole person health to make the work even greater so that people can feel whole in every way, as one of the areas that we still feel a little bit challenged in through champions that we need.
I think I want to jump in after that because it goes right in line with what I've perceived mostly as the challenge now that I've been serving as the chair of the commission for the last year. And it's the full integration of the Health Commission into the life and work of African Methodism. So in all our ways, we have to reconnect the connection. I mean, we have some of the most wonderful resources in every area of our church, and somehow we're just not aware of them. And so, for example, we've encountered things like somebody publicizes that they're getting a $5,000 grant for some program that actually we started 30 years ago, and had the opportunity to have a $500,000 grant if we hadn't been concerned that your name, you wanted to have your local $5,000 relationship that was brand new, if that makes sense, as opposed to saying, listen, we are the African Methodist Episcopal Church. For example, we have this partnership, this longstanding partnership with the Alzheimer's Association. All relationships with Alzheimer's associations should come through the AME Health Commission, not so that the Health Commission could control it, but rather so that we could leverage our connectional power and strength and ability to influence legislation and influence people and things like that. So we do ourselves a disservice when we remain disconnected. And then, as Elder Swinton just said, for us as a denomination, we are liberating and reconciling. For us, salvation is not a glory in the afterlife. It's about wholeness. It's about the whole person, the whole body, from the crown of your head to the soles of your feet, to your soul, to your mind, to your heart, to your life's work. All those things for us are connected. It's health. It is health all together. And so it is odd to not do better at fully integrating the resources available through the AME Church Health Commission into the life and work of the AME Church. And the last thing I'll say, because you did mention the last 3 years, Dr. Burnett has been retained by some of the greater entities in the United States to draft policy. And the COVID protocols, for example, that she drafted, that we were able to put out through the AME Church, are sometimes ignored by the AME Church, but they're actually used by other denominations and other community organizations and even other medical organizations as the standard. And so not lifting up our own resource that we bring to the table, that we are actually leaders in the fields, and then sometimes we treat each other with less respect than I think we should.
My. Anyone else wants to comment on that?
I think the other thing that we all as AMEs give of our time, talent, and our treasures. However, when it comes to the Health Commission, starting all the way back before Gwen, all of the funds, or 95% of the funds, come from our pockets for the supplies, for the travel, for everything that we have done. The website that everybody thinks is so wonderful was created in a partnership with two men and myself sitting in my office at ITC. We funded the development of that. Hundreds of thousands of dollars creating AMEChealth.org out of our pockets. The travel that occurs, I remember one year my accountant said to me, if you spend one more dime on the Health Commission, I quit. You're not going to be retired because your retirement funds are going to the Health Commission. It's that kind of sacrifice that we all do, Dr. Collins, Dr. Williamson, all of us, all of the nurses, all of the professionals, healthcare professionals and non, who have devoted their time and their effort and sacrificed their family, their jobs. I remember one year, Gwen was so far out of vacation time that they threatened to fire her. But we do it because it's a calling. It's a sacrifice. God has blessed each and every one of us to be able to do that. But it's a calling. And sometimes it feels like a burden, but then somebody will come by and say, you helped me to figure out how to care for my mother, how to care for my father, how to care for myself. And then that pushes us to do it again. But it's that stress and burden of, you asked about challenges, the stress and burden of what is asked of us that is not received, or received in a way that is not encouraging to us. But at the same time, those that don't look like us welcome us and ask us to help them in real ways. And like Bishop said, that's discouraging. But it only takes one person to say thank you. And we'll keep doing it.
Well, when this goes live, I'm pretty sure that you will hear and see and watch those saying thank you in the chat. And I'll just say, I mean, I am one of those. I've always believed in the work of the Health Commission, but especially, and this is my own private mea culpa moment to Dr. Burnett. After the general board, I know all of us were like, why do we have to do these COVID tests again? And a friend of mine said, we always complain about this stuff, but the Health Commission is normally always right. And what happened at General Board, or what did we hear happen at the CME General Conference? So on behalf of those watching and those who are commenting, we thank you for what you do. And also, as we go to commercial break, I do want to say that when we cut the budget by a quarter in the middle of the pandemic, the first thing we cut was the Health Commission. We're going to hit our commercial, and then we're going to come right back to our next section.
Beloved in Christ, my name is Julius Harrison McAllister Jr., and I'm an aspirant for Episcopal service in the African Methodist Episcopal Church. I presently serve as the pastor of Bethel AME Church, and I've served as the senior minister of this congregation for a total of 14 years. I entered the ministry 30 years ago, and I want you to know, by the grace of God, we've given over $1 million in outreach. We've built 75 homes at a cost of $14 million, and we've helped thousands of people overcome their greatest drug or alcohol addiction. Beloved, I seek your support. I'm asking for your prayers. I'm asking for you to call our name as we offer ourselves as a candidate for the office of bishop in the life of our ecclesial institution.
And we're back. Thank you for joining us this afternoon as we share in the work and ministry, celebrate the 30 years of the Connectional Health Commission. I think it was last year, 2 years ago, we lost the immediate past director of the Connectional Health Commission, Dr. Chiquita Fye of Georgia. And we just want to take a moment to reflect on her life and ministry. She served faithfully for many years and talk about, what she meant to the connection and her part in the forward momentum of the Connectional Health Commission.
Gwen?
Dr. Fye came on board in 1984 when we were in the General Conference in Kansas City, Kansas. And it was kind of an accidental coming together because there was a lady who was a diabetic who had not eaten, and she came to the first aid room saying that she didn't feel well. She felt lightheaded. And when we checked the vitals and her blood sugar, we found that she had extremely low blood sugar. So we gave her diabetic snacks and told her to go and get something to eat. And we were at the final phase of the General Conference. The Episcopal Committee was reporting, and this call came out, we need a doctor over in the 5th District. And so Dr. Fye, I believe, was the first person to arrive on the scene, and she immediately took charge. And we were able to get the lady back to the first aid room, which had been packed up, and we had to unpack everything so that we could deal with her. And the problem was that she did not go and eat like we told her to, and the diabetic snacks had gone out of the system. And so this is how Dr. Fye came into the Health Commission. And we later asked her to be the medical director because we had to have a doctor on board for the commission. And she agreed to do that. And then she began to advocate for money for travel, housing, and food, because we were working out of the contingency fund, and we were working under the direction of the Stewardship and Finance Committee. So she was a strong advocate for them getting funding to us. She also advocated that they would pay for any equipment that we needed so that we didn't have to continue to do these things out of pocket. So she also, when we got to the 1992 General Conference, she lobbied very strongly for the establishment of the Health Commission, and that the Health Commission would be a member of the General Board. And so she had a lot of energy, and she was quite outspoken, and we got things done because she tread where I did not want to tread. And so we had different personalities, but she was a go-getter.
Well, we celebrate her work, and I'm sure she is proud and will be proud to see what the Connectional Health Commission has done to help save us all in the midst of this global pandemic. You mentioned the Alzheimer's Initiative. So, Dr. Burnett, members of the commission, help us to understand, what are the other things that the Health Commission is working on? Because there's so many things that you all have. I've got a whole crate of survival stuff in my room that I bought from the Health Commission. That's one of the things y'all have. But tell the people, because I think people sometimes just don't realize what all we have. So what are some of the major initiatives that the Health Commission is working on?
Well, the first one would be the HIV/AIDS ministry of Dr. Ovita Fuller leads that for us. Microbiologist, virologist, world-renowned, sits on the FDA board regarding COVID vaccines, and she teaches every year the HIV/AIDS training that is now required under her leadership, established and voted on and voted in as a part of the discipline. There's a 3-hour course that's required of all clergy and lay leaders that has to happen at least once a quadrennium, so that we stay up to date on what's going on and how to address it, because we need people to understand that HIV is not going away. We have wonderful drugs to treat it, but that means you have to be tested in order to know that you need them or that one needs them. And also that the best treatment is actually prevention. So we still have a long way to go regarding HIV/AIDS. And so that's one of our strong parts. The Alzheimer's Association partnership helps us with caregiver resources that helps us to understand Alzheimer's and dementias, to include that which comes from strokes. Many people don't understand that micro strokes, little bitty, teeny tiny little strokes accumulate, and that can lead to dementia. And so that ties us to our nutrition and exercise. That part I'm going to toss to our nutritionist. And that also then ties us to our chronic disease prevention. So some of the things that we do cross the lines. We now have a wonderful mental health partnership with the Henry McNeil Turner Association. The Dr. Tony Liggins Johnson is our lead for that. She's a psychiatrist out of Ohio. And she and many of the psychiatrists, chaplains, psychologists around the world actually helped us with the things that we were talking about, especially during COVID, and how to deal with the mental health challenges. Dr. Marion Creighton is in charge of our ministry to those who are differently abled. We need to make sure that our congregations know how to provide resources for those who are differently abled, who know how to help them be able to understand what's happening in Sunday school or worship. People learn differently. And so that's also a part of that, as well as those who are physically challenged. What happens if there's an emergency? And how do we get people out of the building safely who are in a wheelchair, who are on canes? How does that happen? That ministry is in charge of that. We have clergy and family health. Next month, August, is annual clergy and family wellness month. And in that, we spend every week trying to address a different topic related to family health, whether it be blended families or sexuality or financial wellness, or how do we decrease and reduce stress and encourage sabbatical and clergy self-care? How do we deal with the physical and mental burdens that come from pastorate and clergy in general? Obviously, you know, of our communicable diseases and immunizations. The Pennsylvania branch of the Health Commission was just awarded July 1st, $250,000 to be able to create what we're calling AME-AV, advocacy, vaccine, and education around COVID. But we asked them if we could expand it to the others. We're going to take that template and march it straight across all 20 districts. This is a program that, because of the dividing line, is 1st District and 3rd District working together to create an atmosphere where we are educating people on the need for immunizations. We are watching more and more communicable diseases on the rise. And we need to address it. We need to stop it. We need to know what to do with it. We need to know how to recognize it. And so we do series and series of workshops and put things on our Facebook page and the website and send out through Twitter around this. And we have a reputation with CDC of being the arm that they can come to address Ebola. Much of what happened in Liberia in particular around addressing Ebola came from the ideas that I and others gave CDC in order to address. Then they helped us get the supplies we needed to Liberia. It is that kind of partnership. I've got now really good friends who I've met through over the years at CDC who call the AME Church Health Commission a public health machine, because they know in the drop of a hat, they can pick up the phone, they can send us an email and say, we're in trouble, help us. When we talk about chronic diseases, we already talked about Alzheimer's, but diabetes, we need to understand in wellness pamphlets and churches and brochures and announcements that happen on Sunday, how to deal with, ties it right back to the nutrition and exercise piece, that if you get Reverend Natalie on your case, I can attest to that, you have a real issue, because she starts pulling things off your plate virtually. We have collaborations, we talk, and now one of our major pieces is disaster preparedness and response. Some 15, 16 years ago, Reverend Natalie and I sat down and drafted a disaster preparedness manual. Many churches adopted it, many did not. But what we need to make sure that we're doing, as you did, Dr. John, get all of the things you need in your house. My entire garage is full of disaster preparedness equipment. And it's funny because people come to me and they say, can we have, no, you can't have my generator. But first aid, CPR training, earthquakes, other natural disasters, we assist all across the connection. We provided some resources to Presiding Elder Swinton. One of the things that's key, though, is if we don't know who to call, when resources are allocated to us from a variety of sources, then we spend and waste time, precious time, responding to something that we could have prevented. For instance, we just got donated 44 pallets of water. Poor Dr. Collins, who is now leading this and has taken it over for me, spent 3 days trying to find out where we could send it. If we had the names, contact information, and when that changes, let us know who that is, we would be able to respond in real time, because agencies know that we can get things and resources where they need to be immediately. They call us all the time. We don't have to go ask. They just give it to us, but we don't necessarily know where to send it.
Wow. Just the fact that to see that we have that type of respect because the work that we've done, others see what we do and others come to us, but due to our own whose name is going to be on what, this, that, and the other, it's just, but again, I know the people that you have helped, and I know those of you helped, whether they want to admit it or not admit that you've been helped by the Health Commission. And so again, you are a jewel and a treasure to the church. I mean, between Alzheimer's, diabetes, dietary choices, and we're going to talk about dietary choices before we end this thing, because I have some bones to pick with some classes who like fried chicken. But I'd like to move on before we hit our next commercial break to ask about, you talked about this. Let's dive into this. How can people, our viewers who are watching, support the work of the Connectional Health Commission in their local churches, because there are some people here who might have a local health commission that never knew there was a Connectional Commission, or have a health ministry that never linked up, or vice versa, didn't know we have one. So what can we do, the local AME person, the person who shows up every Sunday, to support the Connectional Health Commission's work?
I think the first thing to acknowledge is we need to know who you are. We need to know who is the key person in the local congregation. Who's the Episcopal District Health Director, Presiding Elder, annual conference health director. Each level of we have replicated the levels of our churches in an effort to make sure that we get down to the local level. So we need to know who those persons are. And then there are 5 Episcopal districts that don't have health directors. So we have no way of knowing how to reach out and provide the services to support. The other thing is, if persons want to make sure that they are connected themselves, we meet every 4th Saturday of the month. We shifted from Friday to Saturday at 11 a.m. Eastern time to make sure that our global brothers and sisters weren't up in the middle of the night. They are coming on, and they're coming on almost more than the folks in the United States. And so the question becomes, what's happening in the US that the engagement is not what it could be or should be? And the other thing is, we need finances.
Anyone else want to hit on that? And we won't press you for those 5 districts, but by the time this goes to air, you can write those, and we'll write those in the chat for you to see which 5 of those are, because we have no problem with the Christian Recorder. I mean, well, anyway, continue on. Anyone else want to chat on this subject?
Yes, we want to concur with Dr. Burnett, what she has said. One area we can begin with is also prayer. We also need to pray for the Health Commission for that work. It's a very important ministry because it deals with the lives of people from birth to death, the health ministry's work. We need people to come with their talents, with their time, their gifts, to get involved. One of the areas that people should also know is that although it's a health ministry, the persons that are involved do not all have to be health professionals. We do need people with media experience, graphic designs experience. Any of those gifts that people can bring will help. And because of the involvement, if all of the components could get involved, we could also have champions in each of those groups to help do the work of the health ministry. And at the local level, the local pastor is very key. I had the experience of being the 7th Episcopal District Health Director. There was one pastor who became ill. And when I went to visit him, he was diagnosed with stage 4 cancer. He looked at me and he said, if I had my ministry to do all over again, I would make health a priority. It was one of the things I felt like a door-to-door salesman when we were doing that work, just to encourage pastors to include health as a part of the total ministry of the local church. And those churches those pastors that supported that saw some great impact. As a result of that work on the 7th Episcopal District, we received recognition from the governor of South Carolina. And then later, we received a recognition from the National Governors Association, and as a best practice model for all of the states in South Carolina. And they encouraged us to share all of that information with other states so that they could also impact their people. So we need that. And we also need the financial support that Dr. Burnett has mentioned to assist with all of the supplies that are not given, and also to assist with travel and other budgetary needs. It's very, very important. And we have been benefiting from the work of the Health Commission, especially on the continent, especially through, I know, I'm not sure, I didn't hear her mention about the church gardens, but it's one of the areas that's very important. And where I'm located, we are hit by cyclones and tropical storms every year. And this year, we had so many families who lost their homes, they lost their livestock, and they also lost their crops. So doing the farming, very piece. So we need any supplies that can help with farming, all of those things that can lead or contribute to whole person health. Thank you.
To the conversation was the fact that we need to make sure that we're sharing that, as we said earlier, the International Health Commission, the Connectional Health Commission has the resources that many churches and communities are looking for. And so we need our other sister organizations to begin to, share with, as they make partnerships, share with information about the Health Commission. And then as Presiding Elder Rosetta Swinton said, sharing within the churches, the local churches, said, hey, you don't have to recreate the wheel, because a lot of the information you're looking for is on the website. A lot of the resources are there. Many are free. And sometimes the partnerships that we have made, such as we have a partnership in Ohio, and it's the Cleveland Nutrition Label Partnership. And the Center for Black Health in Ohio, well, actually, they're not just based in Ohio, but the Center for Black Health came to the International Health Commission and said, hey, we want to give you this grant. This is the area that we're looking at. It's in Ohio. And so right now we are working in Ohio in the 3rd Episcopal District on a nutrition facts labeling, focusing on how the importance, I should say, of reading labels and making sure people are aware of the amount of sodium in food in order to address and prevent stroke, high blood pressure, and heart attacks, and other preventable diseases related to that. Chronic diseases. So again, it's sharing the resources. It's making sure that the word gets out, because we shouldn't be competing with each other in the house. Okay, we should be supporting one another, because many times we have partnered with other organizations, the WMS, the women in ministry, and the Sons of Allen. And again, those partnerships allow us to reach more people. And in so doing so, then the word gets out. So I just think it's so important that we share those resources, we share what the Health Commission is doing, and that would allow it to continue to grow. And that support that way allows us to continue to seek out the resources as we do, in order to be what we are called to do, as Dr. Burnett said earlier, called to do and committed to do within the Zion.
So it sounds if the connection would be the connection, we can stay more connected. And again, I would also say that the Health Commission, whenever there's been something the Health Commission has done, we have shared in the recorder. There was a time when you all sent in articles, but then COVID hit, and so then we just got COVID announcements. But but whatever y'all have had, we've always shared, and we thank God for you. We're going to hit a commercial, and then we're going to come to our final question, mine and Bishop Brookins' favorite, about why y'all eat that fried chicken and the skin at the church. We're going to go to commercial and come right
back. Pain has a personal touch that they add to the theological education. It's not that we just get you there and educate you and send you on your way.
It has really developed me in my expanding of my mind, my thinking process, my thought process. It really helped me to grow in how I debate, how I view things.
I'm tearing up about it now because it was a journey. It was very hard. But having those professors and those mentors and that family experience believing you, to journey with you and to know that they believe in you, I don't think you can get that somewhere else.
So we're here at the end of our time with the Health Commission, and there's one question that we wanted to ask, and it's we've been hinting all around it, but I want to go at it head on. How can we be a healthier church. Now, I know that one thing that Elder Swinton mentioned, and I want to lift up, is the garden initiative that's led by Reverend Carolyn Cavanis through the Health Commission. We've gotten so many calls about gardens. And in fact, I ran into one pastor who's a friend of mine who said, we're starting a garden in our church. I said, well, didn't you know that Health Commission has a garden? They said, we never knew. I said, well, and I sent her an email and said, call Carol and get some free seeds. So, but that's about producing our own food. But more broadly, how can we be a healthier church? And I don't mean to proselytize, but I thank you, Dr. Burnett, for making sure we have wellness breaks at meetings, for making sure at General Conference, quite frankly, I was on the stage, we had nowhere to eat. So we were only eating the processed food in the back. And I saw at least 2 bishops almost have diabetic attacks because they could not get anywhere to eat because we were in that meat grinder of a session. So our very process sometimes is unhealthy. So I just asked this. I've said what I wanted to say, but how can we be a healthier church?
Well, here's the question. Jesus asked the question, do we want to be whole? Do we want to be healthy? So we have to start right there. And that's a major question that we have to answer across our connectional, because I often, as a registered dietitian, run into the fact, well, someone will say to me, well, a little bit of, soda won't hurt, or a little bit of donuts won't hurt, or a little bit of cookies or potato chips. And then when they talk to me about how they're eating, it's not really a little bit at all. It's what they eat all the time. So we all have to ask ourselves, and I like what Presiding Elder Swinton said earlier, at all the levels, of our leadership, clergy, every level, wherever we have a leader, we need to begin with them being role models to demonstrate this, because that makes a difference. She called them champions. I call them role models. And we first have to ask ourselves so that we don't push making those healthy choices aside or almost making it a joke because it matters. Clergy need to be healthy. Congregations need to be healthy to do the work. And if the clergy or the leader is not healthy, then the work could be hindered or at least delayed. So we want to make sure that we are supporting it in that way. You mentioned the farm and garden. And yes, what a major project that's moving across the I-95 corridor, but also throughout our connectional church. And we want all churches, and you can go again to the website and get more information. As a matter of fact, you can get a $500 grant towards growing your own garden at your church or in your community. And yes, you want to contact Reverend Carolyn Cavanis to get more information, but you can find that information on the website, as well as the workshops that she conducts every month, so that you can begin that process. We also have other programs that support this. So for example, July is Faith, Health, Wellness, and Nutrition and Fitness Month. And when in mentioning July and August, Dr. Burnett mentioned August being clergy health, but these 2 months, Dr. Burnett and I sat together because as we took a look across the health themes that are throughout globally and the United States, there was not a health theme that focused on the faith-based community. And yes, in the faith-based community, we're recognizing Diabetes Month and Heart Health Month and all the ones that I could mention, but we wanted to pull them all together so that the faith-based community, not just the AME Church, but the faith-based community, because we invite others to join us in July and August, to be intentional about preaching sermons on health and wellness, about serving that healthy food. We don't have to have the just the fried chicken all the time. What about the baked and the steam? And what we find out, as you just mentioned at many of our major meetings, you go to a meeting and there's no healthy choices. There's our traditional soul food that we know can cause high blood pressure and can cause other problems within our health. But where are the healthy food choices? So we have to be intentional, at least offering those choices. I like something that Dr. Burnett says, and it's a part of her quote in our Culinary RX AME program. The Culinary RX AME program is a international program, and we have partnered with the world's largest online culinary and nutrition program, that is Ruby, a really good partner with us, and it teaches you how to cook healthy food, but not only that, how to understand how what we eat affects our health, because food is not neutral, as we heard in our webinar that we had. But Dr. Burnett said that, in our congregation, we have people who are sick, But yet when they are at our functions, our prayer breakfast, you come to the prayer breakfast, you've got donuts, you've got sweet juices, you've got all kinds of things that are going to raise your blood sugar and other things, but you don't have the foods that have fiber in it to make a difference. So my point is that with July and with August, we want to be intentional so that we can look at being whole and being healthy. So when you partner with the farm and garden program, it's right there for you to start that initiative and even move over to grow more healthy food in your home. When you enroll in our culinary RX, AME RX program, only $49.99. And you have lifetime access to learn how to do things like, I bet some don't even know that you can take the liquid from chickpeas, and you can take that liquid and you can whip it up, and you add some confectionery sugar and some vanilla, and you have a wonderful topping that you can put on anything that you might want to put it on, your fresh strawberries. But it teaches you ways so that you can consume more plant-based foods. Not that you have to become vegan or vegetarian, but that you can consume more plant-based foods. Why? Because all of the major health organizations, the American Heart Association, the American Diabetes Association, the Endocrine Society, I can just go on and on. All of them let us know, the Harvard Healthy Plate, Diabetes Healthy Eating Plate, lets us know that when we eat a plate that's mostly plant-based, a small portion of meat if you eat meat, but mostly plant-based, we have found evidence-based research shows that that's how we fight disease. So to your question, how do we become a healthier choice, healthier church? We've got to offer these, and we've got to have leadership being that role model and showing people you may not be an expert in it. You may have some health issues that you're working on, but that's okay. But if we talk about it more, preach about it, offer it in our Bible studies, have the pamphlets around, have those healthy food choices, have some water with just some fruit in it or some basil in it, and not just the sweet tea. Okay, getting away from just that, like again, that traditional soul food and making our soul food healthier. And that's another thing that Culinary RX AME does. It helps us to learn how to make our soul food healthier so we can still enjoy it, but we certainly need to make sure that we put that in place. And then there's lifestyle medicine. Seems like a new term, but it's a term that's been growing over the years. And when we talk about lifestyle medicine, it reminds us that, yes, we need quality access to health care. We can't excuse that. We want doctors to treat everybody well. And we want people to have health insurance. But sometimes your job doesn't offer it. Sometimes where you are located around the world, you don't have access to this health care. So what can you do? Lifestyle medicine. Lifestyle medicine is evidence-based, not something that we just created. It's evidence-based, and it's partnering with your doctor, but also self-care, that you're going to manage your stress. You're going to make healthy food choices. You're going to drink more water. You're going to walk more, whatever exercise that you can do. You're going to stop smoking if you smoke. You're going to manage, if you drink alcohol, you're going to manage how much you drink. You're going to continue to take your concerns, your health concerns to God in prayer. But lifestyle medicine, I like to say it's accessible because it is. It's affordable because many things I mentioned are free. You don't have to go and buy it from someone or enroll in it. And not only that, it's affordable, accessible, and it's something that is doable. It takes time, because anything takes time, but we need to continue to share that in our Zion, that lifestyle medicine can make a difference in our life, because it can also be a global answer to many of the health issues that many are facing. And why do I say that? Because again, you can have health insurance, you can have a great doctor, but that doctor told you to walk, okay? And if that doctor told you to eat healthy, that's on you. And guess what? That's a part of lifestyle medicine. So again, those are the ways that we can be a healthier church if, as Jesus asked the man, do we want to be whole? Do we want to be healthy?
And let me just add to that very briefly. Time management. You mentioned Dr. Thomas. I call you Dr. Thomas because you are. The schedules that we create for our meetings and for our lives. As African Americans, predominantly African Americans, I firmly believe we need to teach people to come out of the production mentality and to follow biblical principles about rhythms and balance. So, for example, as a pastor, it was very important to me in training people coming into ministry that planning time off was an essential part of their vocational discernment and planning. And what I notice, especially working with these persons in the Health Commission, is that they work 24 hours a day. And I see the same thing among many of our pastors and lay leaders. We have lay leaders who are working 9 to 9 jobs, and then they get off and they come straight to church, and it's another job. And people are walking around burnt out and beating each other up, and creating unsafe spaces in places where we're supposed to be able to have sanctuary. So I think that will help us be healthier if we can also find a work-life balance and be more intentional about time management.
Amen.
Amen. I think the other thing Dr. Natalie touched on was our farm and gardens, but I really want to talk about its impact. The impact of the farm and garden ministry has allowed for jobs. It's allowed for the greens that we who are old enough and grew up on farms. I grew up in New York City, but I spent every summer on a farm in South Carolina, and I knew that greens were supposed to be dark green, but what we get in the store now is light green because we have destroyed our land and we're feeding it with all kinds of garbage. But if in fact we start growing our own and growing it in a very organic way, and sometimes that language gets misunderstood, but if we grow it the way God intended us to do, we will get the nutrients and the minerals that we need from our food. But when you look at jobs, there is a congregation in the 18th that we gave a drop of money to. They had a 90% unemployment rate. Within 2 weeks, they took the plan that they had to present to us and implemented it. And in implementing it, they were immediately able to hire 3 people and the pastor in the next town to be able to help them build their mushroom sheds. Well, the government partnered with them, and now they're going to take the drop of money we gave them and generate thousands and hundreds of thousands of dollars, and they're already expanding those that they have employed. We have the ability to do that everywhere, and we need to.
You know, I know sometimes when we have these discussions, and I know people always like, the Health Commission, whenever you all come out, it's always, what are they going to tell us now? Because it's normally something that we don't want to hear about, get this check, get that check, don't do this, you need to do that. But if we would just listen and be open and understand what work you are trying to do and what work you have already done, and the fact that, like you all have alluded to, we are living unhealthy lives in this church, and we need to be healthier. We can only be healthier. Physical and spiritual go together. Elder Swinton wrote in the comments about our bodies being temple of the Holy Spirit, and the fact that this is all linked together. And we wonder why some of these preachers are leaving early, stroking out, or having these issues. It's not rocket science. And I also think some of this, and this is my one thing, is gendered as well. It's not an accident that our female-led, medical doctor-led health commission is telling this to a certain type of church that still has a patriarchy embodied, that doesn't want to receive these things well, these things that could save its life. But I thank God for you. We are delighted. Go ahead, yes.
What you're mentioning, you think about it, COVID-19 taught us something. So to your point, for people of color, because we are the ones that rank the highest in preventable diseases. And I have to say again, preventable diseases such as heart attack and stroke and obesity. It taught us, as we were seeing, unfortunately, those that we love and family members succumbing to COVID-19, we have to learn from what it taught us, meaning that now we can't go back into doing everything, as Bishop said earlier, the way we used to do it. We have to find a different way of doing that while still completing the work that we need to do. So yes, the breaks and balancing, but also getting the rest. And also, again, going back to those healthy food choices, but finding a different way to do what we need to do, because why spend these 3 years learning this, but running back and having those big meals the way we used to have them, running back and having those back-to-back meals the way we used to, and not taking care of ourselves. We have to make that choice to make that change, and know that making that change doesn't make us less spiritual, because we're helping ourselves. And not only that, we're preparing for, and I know Dr. Burnett will agree with, the next pandemic, because there's going to be another one. We've got monkeypox it's now emergency. Okay. And I heard today on the news, United States of America is now passing other countries. So I'm not saying that it's going to be a pandemic, but there will be another one. And whether it's in our lifetime or not, we need to learn how to navigate. And we heard that term a lot, this space that we're in, and how, again, what we've learned. So if we take care of our health, the next time another pandemic comes along, our prayer is that we won't have as many people of color dying from that, as well as other people, because, there are all people of other colors, races are our brothers and sisters. But again, because people of color suffer the highest from these preventable disease, our goal would be to prevent that. And also learn that, again, like we're having this virtual webinar, that we can still be successful to come together. And there's nothing I know that replaces being together in person, but this still works. And we still are reaching many who may at one time, when you think about it, the caregiver who couldn't come to church, the mother or the father that was watching their young one and couldn't make it to church, someone who had to work. Now all these people are hearing the word where maybe they weren't able to hear it before. We're reaching more people. Even our meetings, we're reaching more people, because in some of our meetings, if we're honest, some of the same people were coming to the meetings, but now opening it up virtually, we've opened it up for more people to come to the meeting. So I think it's just, to your point, learning from what we've learned in the last 3 years so that we can gain from it and continue to spread the good news of the gospel and show not just the congregation, but the community, how we can, move forward and promote good health, not just physical health, but spiritual health and mental wellness health and all areas of our life.
Amen. And speaking of which, we're going to show that website one more time so that those of you who are watching can go to the amechealth.org. And we know that you all have your webinars. I believe it's on when are the webinars again, Dr. Burnett?
The fourth Saturday. You're talking about our meeting?
Yes, the meetings.
Yeah, the fourth Saturday of every month. Yes.
Fourth Saturday every month. And in addition to that, yes, go ahead.
At 11 a.m. Eastern. 11
a.m. Eastern. You will find a cornucopia of resources there. And if you want to plant a garden, they have seeds for you. But I thank you all for sharing with us. I thank you all for being with us. And since we have a bishop on the call, we will allow the bishop to give the final words before we move out of this setting. But thank you, Dr. Burnett. Thank you, Dr. Mitchem, Elder Swinton, Exhorter Williams, for being here and blessing us, reminding us of the charge that you work and the ways you help us, even when we aren't as grateful as we should be. Thank you for all that you do for the church. Bishop Brookins.
Let me simply echo that thank you. It is such a privilege and an honor to be able to work with such outstanding, committed, and devoted persons throughout African Methodism. We do want to be made whole. We do want to be made whole. And God requires our work in order to achieve this wholeness so that we can have the impact we have been called to have on the world for such a time as this. It is with excitement that I just close this out by inviting everyone to amechealth.org and asking everyone to go on at least to the website one time. If you're AME, just go onto the website one time and see if you don't find something that enhances your life for the better, and then go be a witness and tell somebody else about it. Thank you so much for this opportunity to serve.
Thank you, Bishop, and everyone. We will see you all next time.